Hi, I'm Dr. Stan Steindl. Welcome to Compassion in a T-shirt. Gregoris Simos, MD, is Professor of Psychopathology, University of Macedonia, Thessaloniki, Greece. He's an internationally respected psychiatrist and a recognised authority on contemporary psychotherapies, including Cognitive Behaviour Therapy and compassion-focused therapy. In 2022, he and Professor Paul Gilbert edited and contributed to Compassion-Focused Therapy, Clinical Practice and Applications, which really is the big book of all things CFT. Many wonderful CFT researchers and practitioners offer their insights into how and why compassion and self-compassion are so important for psychological well-being. Highly recommended. In our conversation today, Gregoris speaks about an area of particular interest to him, which is compassion-focused therapy for depression. He offers a number of very helpful ideas about how to conceptualize and work with depression from an evolutionary, biopsychosocial, compassion-focused approach. I'm very grateful to Gregoris for speaking with me in English, especially given it's not his primary language. Oh, and keep an eye out towards the end to hear his thoughts on integrating CFT and Schema therapy. This is an integration I'm feeling very interested in myself, and so I bring you Professor Gregoris Simos. Today I have with me Professor Gregoris Simos.
Yes.
Welcome to Compassion in a T-shirt.
Thank you very much. Thank you.
It's wonderful to have you and to get to speak to you all the way from Greece. Now, I was just going to dive into some questions. You edited the book Compassion Focused Therapy, Clinical Practice and Applications, along with Professor Paul Gilbert, of course. And this really is such a wonderful and important resource for CFT therapists, but also researchers. What was the whole process like, creating such a, comprehensive piece of work, collecting the chapters, of course, from Paul, but also all of the other authors? There's a couple of Aussie authors on there, which I noticed, James Bennett Levy and Tara Hickey and my close colleague, James Kirby. So yeah, what was that all like to bring that book together?
Yes. I would say that I could have never done this book without Paul Gilbert.
Yes.
Allow me to say that the story starts in September 2018, and we actually published it in 2022. It took us 3 years and a half to have it.
Okay, good.
So in September 2018, we had the EABCT Congress in Sofia, Bulgaria. And my colleagues and I presented a symposium on self-compassion. And the next day, I went to one of those stands that publishers have, and they invited me to write a book on self-compassion and compassion.
Okay.
And they were delighted by our symposium. It was very well attended, and it was very interesting. So they asked me, will you write a book on compassion for us? I said, listen, give me some time. And what I thought was that I could have never done a book on CFT without Paul Gilbert. So the first thing I did was to email Paul and say, are we going to write a book, to edit a book together? And he said, I can write a chapter for that, but I have been doing, or I've been thinking of doing something like this with my publisher, not this publisher. I said, are you? No, I need you as a co-editor, not to write a chapter. And he said, and finally, we agreed that we could do such a book together in his publisher.
Okay, right.
So we started that. And at first it was a book, CFT for Self-Compassion Focused Therapy by Simos and Gilbert. And we started collecting co-authors and contributors. I think we owe all we owe all this to Paul Gilbert. He's the master. He's the one. So he was the one who actually suggested, okay, let's email him for anxiety. Let's email him for CFT with SID, and let's email him for eating disorders and so on. So we started inviting people to contribute to our book. And I would say that it was very welcome. I mean, I can't remember if anyone said, no, I cannot do that. No. Probably one or no more than one. So it was a challenge for all those people to visit this book. So this is what we needed, a big book with all those things inside, because there are quite a lot of books, of excellent books on CFT, both self-help and those for clinicians, but we have never had this kind of book. This is a reference book, I would say, and allow me to say that I think that it must be the book for the next 10 years, at least. I don't think there's a place for another similar book in the years to come. But anyway, I think that was the book that was missing. So we started inviting contributors, signing contracts with the publisher and so on. And then Paul had to decide whether he would have a separate book writing on compassion focused therapy, but not like the one we were doing. And he had been a little bit ambivalent, or whether it should be a separate book or we should combine that book. Finally, as you know, we combined that book. The first 10 chapters are from Paul Gilbert, and the other 17 chapters are from various people around. This was exciting. This was very exciting.
Yes.
I thought several times that I should try to count the emails we exchanged with Paul Gilbert and contributors. But then I thought, it's impossible. I don't think I can count them. Thousands and thousands.
Too big a number.
Yes, with Paul Gilbert and with the contributors of this book with the chapters. But there we are. That was an excellent thing done. Excellent, yes.
Yes, yeah. Oh, no, that's wonderful to hear that story. It really is a very comprehensive compendium, isn't it, of both the theory. Paul offers, I think, did you say 10 chapters, which really describe, a lot of the background and the theory and his sort of model of the mind. And then it's got another 17 chapters that are both kind of practical and kind of for clinicians and so on, and specific topics, special topics as well. It really is a very, kind of wonderful compendium. Little question for you. When you were presenting that very original symposium in 2018 or so.
18, yes.
Yes. Was that a CFT symposium, or what approach were you taking to self-compassion there?
No. It was actually on psychopathology. I've had the titles of the abstracts we submitted. The first one was the relationship of self-compassion to empathic understanding of others. We actually administered the self-compassion scale and the interpersonal reactivity index that actually assesses empathy. And we found also quite a good and welcome correlation between self-compassion and interpersonal reactivity index and empathy. The second one was on self-compassion difficulties in emotion regulation. Actually, we administer emotion regulation in the self-compassion scale, and we saw that without self-compassion, difficulties in emotion regulation are great. So this was a welcome finding also. And the third one was the self-compassion and fear of compassion for and from others. There was a recent article by Paul Gilbert then on a self-compassion scale, a self-compassion for others scale, fear of self-compassion for others and fear of self-compassion from others. And so we administered these 3 questionnaires. So we had some very good findings.
Yes, I mean
And
that's quite fascinating. That self-compassion, so the compassion that we might offer ourselves, is significantly correlated with the empathy that we might be able to sort of use with others, in a sense. So
yes,
what do you make of that? What might be self-compassion's role in empathy for others?
I think self-compassion actually equals self-empathic
Mm-hmm.
for oneself. It's something like similar. I mean, if one is self-compassionate for himself, he is also self-empathic for himself.
Mm.
So that was actually empathize in some way is part of self-compassion.
Yes.
Self-compassion is to be empathic with others, but also to want to help and prevent their suffering or help with their suffering. And self-empathic is understanding the others, the pain of others, the suffering of others.
Mm.
So that was actually the finding we had, but that was expected, I guess.
Yes, I suppose so. And also, I think if I'm able to be self-compassionate, and in other words, help to down-regulate a little bit my threat system, and perhaps shift into a more soothing affiliative system, then perhaps that provides a nice solid ground from which I can then turn my attention to others, and I can start to
Yes.
empathize with others and perhaps their feelings or the meanings there for them and what they're experiencing. So I suppose, yes, it does make a lot of sense, doesn't it, that those two
On
would
the
be
other hand,
correlated.
I think there is a direct relationship between self-compassion for others and empathy for others. This is a
Yes.
direct relationship, I would say, yes.
From Paul Gilbert's model, of course, yes, empathy is one of the competencies, isn't it, of compassion? And so we bring that competency of empathy to our compassionate motivation. So yeah, that's very interesting. And then there was the relationship between self-compassion and difficulties with emotion regulation. So that would be a negative correlation, I suppose. And if a
Yes,
person
yes.
is less self-compassion, then they might have higher difficulties. And then also exploring the relationships between self-compassion and some of the fears of compassion as well. Wonderful. Well, you made several contributions to chapters in the Compassion Focused Therapy book, but the one that really stood out to me, and I suppose I'd be interested in hearing more about from you, is the chapter about working with depression via CFT. And as you know, one of well, I guess we were just referring to the 3 circles model of emotions or emotion regulation: the threat system, the drive system, the soothing system. Could you give us a sense of how you might see the 3 circles formulation of depression, I suppose? In other words, how are threat, drive, and soothing systems activated or inhibited in depression? How does all that work?
Yes, okay. First, allow me to say that I chose to write this chapter on depression because I thought that it would be an easy chapter, but
Okay.
it was not.
No.
It was not.
No.
Because I knew that Paul Gilbert has spent ages in depression, so studying depression, writing on depression. So I thought
That's true.
I had also attended a workshop by I can't really remember if it was Tobin Bell or Chris Irons on
Mm.
CFT for depression. So I thought, okay, I have the knowledge about that, so I can write that. But it was very difficult to conceptualize all these things. And as you can see, my chapter is about 70% conceptualization of depression in terms of CFT, and then only a small part on treatment. So I try to make it clear how those things relate. Depression relates to the evolutionary model introduced by Paul Gilbert. So I think yes, depression has to do with the three system cycles, and I would say that if we take a closer look, we'll see that first of all, the threat system is activated because there is a growing relationship between depression and self-criticism. And self-criticism in an attacking effect. I'm quite thinking of what I'm going to present here. I thought that this is a civil war. This internalized threat that is produced by self-criticism, it's actually a civil war. Half of my person fights with the other half.
Yes.
But this is a disaster, eh? This is a disaster. So I think the threat system is activated. There is an overreactivity of the threat systems. There are quite a lot of negative thought patterns. I'm a failure. I don't count. I'm bad. I'm lost. Don't count, and so on. So this is very harsh, I would say, self-criticism. That is a very harsh threat system condition. On the other hand, drive system is rather inhibited because there is a very, very reduced motivation and low energy. We know that from clinical practice that depressed patients or clients lack motivation. They don't want to get out of their bed. They cannot work. They don't feel like meeting friends and so on. So they spend hours inactive, almost completely inactive. That means that the drive system is very, very much inhibited because of the reduced motivation, the low energy it implies. And I must also say that the soothing system is inhibited. I don't think there is any significant part of the soothing system alive. I would say that the soothing system, I was about to use the word exhausted. I was thinking of today's speaking, and I said that probably the soothing system is exhausted. He cannot do anything more than what he usually does, but depression is so powerful. And so this actually creates difficulties for self-compassion. There's lack of comfort. There's increased self-criticism. This deactivated, I would say, mostly the soothing system. So there's an imbalance, on the other hand, between those three cycles. I mean, this is a huge cycle of threat system and a very small cycle for drive system and soothing system. Is that right? Does it make sense?
Well, I really appreciate the way that you're describing it and those metaphors. I mean, I think the idea of a civil war really does speak to it, doesn't it? I remember I spoke to Dr. Kristen Neff recently as well on this channel, and she described the point of, what if we're going into battle, do we want our enemy alongside, or do we want an ally, sort of a thing? And she described how sometimes self-criticism is more like the enemy, I guess, and sort of whittling away at our confidence and our motivation and all the rest of it. And your metaphor is kind of really interesting as well. It is like a civil war. There's these different parts within us that are kind of having a battle, and the self-criticism is really attacking, some of those more vulnerable parts. So we end up with a very activated threat system. Unlike certain other conditions like anxiety, for example, where we might have a big threat system and a big drive system, trying to overcompensate or be perfect or things like that. In depression, it really inhibits drive, and suddenly we've lost all motivation and that sort of thing. And then the tragedy of it really is the effect on the soothing affiliative system, isn't it? Because the person who's very, very depressed really needs and yearns for social connection and for comfort, and yet is feeling so disconnected, so detached from others, and to the point where others sometimes start to drift away too, because they don't really know how to relate to the depressed person. And so there's a tragic kind of inhibition of or deactivation of the soothing system as well.
Yes. Allow me to say that if we talk about war, that means that we have someone just on the opposite side who I don't know, who I don't like, who maybe I hate. But civil war is very, very different. I mean, it's very painful. I mean, because you might be fighting, your brother might be fighting someone that used to be your friend. So this is very painful to have a civil war instead of having a war with an enemy outside of my territory or so on. So that's a kind of difference, I would say.
Yes, I see what you mean. It's the sort of the quality of self-criticism is more like the Civil War, where the battle is going on within and amongst the parts of ourselves that really we should bring love to, but instead we bring hate and loathing, and that's probably the 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 toughest bit really around self-criticism, is that self-loathing and self-hate and just how painful that is, and leads to depression.
It hurts too much. It hurts too much.
Mm. Mm. Um, Sometimes we think about the three big emotions, I guess, anger, anxiety, and sadness. Often in CFT, we might be working with that. And I suppose I'm curious about your thoughts about sadness, and really what you said just there. It hurts too much. There's so much, well, grief and loss and sadness that's often associated with all of those dynamics that are at play there. What would you say about that? What are your thoughts about kind of sadness and where that might fit into the three circles model, or how that might be related to depression?
I think that sadness also has to do with all three of those cycles. First of all, it has to do with a soothing system that is underactive. Actually, it is believed that depression in some sadness in some way it's something that can be dealt with in the soothing system. I can reflect, stand a little bit, take a deep breath, and face my problems. So that's causing me sadness. But I think that sadness actually in depression is so pervasive that it actually turns soothing system out, turn it off in some way. So it's completely cruel, I would say, to say to yourself, you are bad, you are not, we account for nothing, you are nothing, and so on. It's very, really, very unsoothing thing, I would say. So the threat system also is, I would say, um, overreacting the soothing system, because in depression, I think it's quite significant how powerful the self-criticism is. But self-criticism actually hurts. Self-criticism actually mobilize the threat system, and the threat system actually causes sadness as well as anxiety sometimes and anger. But sadness is also quite expected for someone who is depressed. He's sad, he's very sad. Sometimes there are times in our lives that we become sad for something. I've lost something. I didn't get the promotion I wanted. This is a sad thing, okay. But I can work with this sadness. But in depression, I think I'm run out of fuel, I would say. I don't think I can handle it any way. And of course, drive, I would say also, is in some way inhibited because of sadness. Because if I think that there is no battle I can win, I then put my rifle down, and put the things I have to fight, I put them down. I just give myself in. So I think that sadness also in some way interacts with the drive system.
Yes,
Does it sound?
I appreciate that. A couple of thoughts came to mind. I mean, the first is that sadness can be quite adaptive in a sense. You know, sadness can sometimes be something that brings people closer in a way because they feel moved by our sadness and they want to
Yes. Yes.
kind of help, and it can have that sort of a function. When you were talking about the threat system side, it really reminded me of how there's a critic and then there's also the criticized part of us. And so that's the civil war, isn't it? It is the critic attacking a part of us that is then the criticized part. And it's that part, I suspect, that feels the sadness. The hurt and the tragedy of that self-attack leaves that part of ourselves feeling deeply sad, and that's the bit that is inhibiting. It's a kind of a learned helplessness maybe arises at that level. I think you described the control and learned helplessness kind of model there in your chapter, and perhaps that's where that comes in. Can you elaborate a little bit on how you drew some of those other theories or models into your discussion around CFT for depression?
Okay, let's go first to the control and learn helplessness model. According to that, we need to feel a sense of control over our lives and our environment. As far as I feel that I don't have control, I actually withdraw. I actually start fighting for what I think will make my life better. I accept that this is it. I'm unhappy, I'm depressed, I'm weak, I have failed. So if actually I cannot feel that I cannot control my life and my circumstances, my environment, I actually resign from life. I mean, I give up. So that is the learned helplessness, that I give up. I don't try anymore. So this is something like we feel when we are depressed. Because loss of control is really something that it's unbearable. I don't think I can stand that. We have also to do with the attachment and relational loss models. So
Yes.
we all feel that we need a secure attachment to thrive and feel quite well in relationships. If we have insecure or anxious or avoidant attachment in our childhood, then we are doing not very well with our relationships. And not doing well with my relationship means that I will remain alone. And we know that there is a straight, direct relationship between loneliness and depression. Because if I feel alone, I don't have all this social support I need to thrive and be able to compensate for what I'm suffering. So I think attachment and relational loss models also correlate to depression because of the bad relationships I have, the failings in my relationship, the loneliness, the consequent loneliness, and all of the bad things it implies. It implies, I would say, not replies, it implies.
Yes.
Social rank is another quite good theory, defeat and entrapment model. And when I teach my trainees in CBT or psychotherapy anyway, I remind them of how it is the kingdom of apes. The most powerful two apes have to fight to each other. One will win, and he will be the guy of the tribe.
Yes.
The other one has to kneel, put his head on the ground, and give up. Because if he goes on fighting with the powerful one, he's going to die. If he's not going to stop fighting, probably he will be expelled from the tribe. But if you are expelled from the tribe, you lose quite a lot of safeness. You lose quite a lot of safety. Being in a tribe means that we are too many partners around. We can fight any enemy. But being alone, I don't have any chance of surviving. So he has to kneel and put his head on the ground and says, "Here I am. I don't fight anymore." So this is kind of depression. That means someone who withdraws in order to show that he actually acknowledges his defeat, and that's it.
Mm.
Sometimes there is a theory about reserving sources, probably becoming. I mean, depression was supposed to be adaptive some ages ago, but nowadays depression is not adaptive anyway. Although I say to my patients that listen, what's depression? Depression is how the tiredness you feel when you fight for your life, when you fight in your job, you fight in your relationship. So you get tired. And when you get tired, you get depressed. What does it mean? It means that you stop, you kneel, and you take some deep breaths, wait to re-get your strength. And when you feel okay, then you stand up and go on. That's how I describe depression to my clients, and they can really understand that. So depression is a way to fuel my batteries. Because I feel very much tired. I feel that I cannot really deal with all the pressure I feel. So I can go back, sit down and reflect, try to find a way in a peaceful way to find some solutions to my problems. So this is in the evolutionary way, thinking that depression is a way to to recharge your batteries, to get the strength you need. But if you want to get you have to rest. It's not rest and digest, but it's a little bit rest being in depression.
Mm.
You don't have to work. You don't have to have a reciprocal relationship with others. You are alone, but okay, you are thinking in very disturbed way. But in some way, depression could have been some ages ago a way to withdraw and readjust to the situation and to new situation.
Mm.
And maybe depression might have been adaptive ages ago, but probably it's not adaptive in our nowadays communities where we have very many problems to solve, peace and core. And I have to do a job that I don't like. I have probably a spouse I don't like, I don't love. So I have quite a lot of things to struggle for. So depression in some way is the is something I cannot escape.
Mm. Mm-hmm.
It's not adaptive, but I cannot escape the depression
Mm.
because we have a little bit very different conditions of living nowadays.
Yeah. Yes, no, well, you've mentioned a number of really important points there. And actually, this was a part of your chapter that I really appreciated was when you sort of outlined three key areas of models. There's the control and the learned helplessness model, the attachment and relational loss models, and the social rank, defeat, and entrapment models. And so, yeah, as you've just described, those sort of three there. I remember when I was maybe at uni, maybe even first year psychology, I feel like I remember studies where they put poor dogs into cages that had metal floors, and then they would send electric shocks through the floors. And the dogs at first would run and jump and try to escape the electric shocks. But in the end, they weren't able to escape. So they would just lie down and take it, that they would just take the hits sort of thing. And it really, I mean, it made a big impact on me at the time because it seemed like a bit of a rough thing to do to those poor dogs. But it also made the impact that that's kind of sometimes the feeling in depression, isn't it? Is that there's just these relentless hits that we take.
Yes.
And in
Yes,
the
this
end,
is
that feeling.
I think this is the experiment that actually ascertained the learned helplessness. I mean, this is what one might actually arrive as a conclusion that whatever I do, the electricity is there, so don't fight.
Yes, exactly. I think it might have even been, was that a Seligman study? I should look that up. Yeah, and then there's the obviously yes, the attachment and relational stuff, the social rank, and that part of it seems really important as well. And I might come back to that in a moment. So there were those three models, and then I was going to ask you about the sort of the evolutionarily adaptive theory around depression, and I appreciate what you said there. It's almost like shifting into a recuperative mode or something, that when the stressors and the sort of the various activities of life become overwhelming, then the primitive human or the primitive living being might retreat and withdraw and recuperate before going back out into the fray, sort of thing. And that in a way depression maybe was sort of the origins of depression in an evolutionary sense might be something like that, that it was a way to recuperate. But like so many evolved aspects of the human brain and body and so on, there's trade-offs, I guess, and we're now really experiencing that. Depression has become something that's perhaps not recuperative in that way, but is yeah, really very difficult to shake. So back to the social rank piece. Shame, I guess, is one of the consequences there. You described it with the was it the gorillas or the sort of the primates, that the one that loses the social rank has to bend the knee and has to bow the head and has to kind of sort of subjugate, I guess, to itself to the higher ranking member of the group in order to not be thrown out into the wilds, in order to stay, somehow safely in the group. And that just reminds me, I guess, of just that experience of shame that we can have, and how that's part of depression perhaps as well. Would you have any thoughts there about shame and depression and where CFT can be helpful?
Okay. I would say that if I have given a fight and I've lost, that's a fact. So maybe it's producing shame, but this is a fact. Unfortunately, many people who feel shamed for what they are, what they have done, and so on, it is not a fact. It is the way they perceive the reality. So if I cannot actually be, oops, that's not right. I mean, as far as I can change reality as there are hundreds of ways to perceive the same reality. So people in depression think in a way that actually devalues them, and they make them think that I'm not adequate, I'm not worthy, I'm fundamentally flawed, so it makes them feel ashamed. But this is a very unhappy feeling, and there is a fear of being exposed to others. Okay, no one is perfect. I know what my flaws are, but I don't want to show them to the others. So if they actually understand what my flaws are, I will feel really unhappy and very ashamed. So in the role of depression, shame actually empowers a negative self-view, and there's a reciprocal relationship. The more shame I feel, the more depressed I become, and the more depressed I am, the most shameful I feel. Because we know from cognitive therapy that probably people in depression, and not only in depression, actually think in black and white ways uh, concerning themselves and others. So I am others perfect, or I'm nothing. So I have so many flaws, or I have none. So if I have so many flaws, I feel very much ashamed. And same actually have a consequence, social withdrawal. If I think that I'm too much flawed, I have to say no, I'm not coming if they are inviting me somewhere. And I think if I uncover myself, they will understand how flawed I am. So I'm not going there. So there is an inevitable withdrawal, social withdrawal, when one feels ashamed. And this also actually activates the threat system, because it's a little bit again like a civil war, because both self-criticism and shame actually are the ones who trigger the threat circle, and when this is triggered, it causes pain, disaster.
Mm. Yes, I appreciate that idea of the reciprocal nature of shame and depression. That's really helpful. It's a little bit chicken and egg in a way, isn't it? Which comes first? You know,
Yeah.
sometimes it might be shame that starts, and the feelings of inadequacy or inferiority or low self-worth, perhaps that starts to drive the depression. But then the depression can also start to drive the shame, and so they really do feed off each other a lot, and it's a kind of a social threat function, isn't it? The shame, it feels like, how am I being held in the minds of others? Are others seeing me as inadequate and unworthy? And maybe if they are, then I should see myself as inadequate and unworthy. And so it's threat system activating, but in particular, it's that kind of social threat and threat to, I guess, social rank, really, and where we
Somehow,
belong
yes.
in the group.
Somehow, yes. By the way, you reminded me that there is so much writing or repetitive negative thinking and repetitive negative thinking, and how repetitive negative thinking is a psychological marker for depression.
Mm,
And as far as someone is repeatedly thinking in a negative way, he finds himself not good enough, not perfect enough, and he finds himself self-attacking. He finds himself feeling self-criticized and self-ashamed. So,
mm, mm. I remember Chris Irons, I think it was, describes the unholy trinity of negative thinking, which is sort of self-criticism, rumination, and worry. You know, that those
yes.
three really are
Mhm.
very, all of them, they serve to activate threat system, and can
Mhm.
also
Mhm.
really contribute to depression, I suppose.
I can't really remember the name of a female researcher who actually passed away, but she has given her life in negative, repetitive negative thinking. I can't really
Mm,
remember her name, but she's
mm,
the one who actually wrote quite a lot and had quite a lot of experiments and studies on repetitive negative thinking. So, and as a marker of depression.
mm. Yes. Good. I mean, one of the things that I'm sensing from you talking about depression and the formulation there is that it really is in and around uh, threat system activation, social threat, certain social fears, not least around attachment and relationships, inhibited soothing system, activated threat system. What are some of the fears, blocks, and resistances there for
Mhm.
a person with depression, perhaps, who might think about self-compassion, but then feel like they sort of balk at the idea? What have you
Mhm.
noticed about all that?
Yes. I think that compassion, self-compassion is a word that creates quite a lot of misunderstandings.
Yes.
Some people perceive self-compassion as giving up to others, if it's the right way of saying that. Giving up to others if you are compassionate to others.
Mm,
So people sometimes fear compassion as well as self-compassion because they think they might become weak if they get too much about others and giving too much to others. And they sometimes fear that they will lose control over their behavior, and if they do so much of um, for relieving the pain of others and being so compassionate and so on. Sometimes people fear to change because they think, okay, I know who I am, I know what I'm doing, but I feel safe with that. Maybe it's a little bit maladaptive, but I feel safe with that. It's quite familiar for me. How would I be if I change? How would I be if I become more compassionate to others? How will I be if I become more self-compassionate? So they prefer to stay where they are because it's familiar. It's not something they don't know. I think they are the main fears of self-compassion.
Yes. Yeah, no, that's there's two sort of threads there. One is that compassion or self-compassion is kind of weak or dangerous. People might take advantage of me. It sort of
Yes,
feels
yes. Mhm.
exposing in that kind of way. And then the other block is, who do I become if I make a change like this? I'm so familiar with and almost comfortable in my current state. It's scary to imagine, how things might be different and what life would be like. I think Paul is doing some research, if I'm right, about fears of positive emotions, fears of happiness, for example, and that sort of thing. Do you ever find something there that people feel fearful or sort of apprehensive in some way about being happy?
There is a saying that I feel like the calmness before the how do you call
The
it? The
storm.
bad weather and the storm. Yes, yes. So there are people who actually are fearful of being calm, of feeling happy because they say, okay, I'm feeling happy. So I think the disaster is coming now. So they don't
Mm,
feel very well with being
yes,
relaxed or happy because they think it's the calmness before the storm.
but the storm. Yes, that's interesting because you kind of between a rock and a hard place. If you're feeling very depressed and you're feeling self-critical, then that's kind of threat system activating. But if you're feeling calm or even happy, then that's threat system activating as well because you're fearful of the storm that's sure to follow. You're fearful
Mm.
of things going wrong again and so on. So it's almost like either way, the person might be threat system activated.
I think probably yes, yes, you are right to that, Stan. I think that there are people who, when they feel happy or contented, they think like, do I deserve that?
Hmm.
What if I don't deserve that, and I will be in some way punished for having something I don't deserve,
Mm.
and it generates threat again.
It generates threat again. Yes, I was just
Yes,
thinking that it's a little bit all roads lead to Rome, or perhaps all
yes,
roads lead to Athens, perhaps would be better
yes.
to say. It all brings us back to threat system. Now, one of the things that I've noticed you seem to be becoming interested in is sort of the integration of CFT with schema therapy, and that's something I'm very interested in as well. I recently spoke to some Australian colleagues on this channel who were looking at schema therapy, but applied to forensic populations, and so and where does compassion fit in there, which was a very interesting conversation. But yeah, how do you envision CFT and schema therapy perhaps working together, uh, maybe with or in the context of depression? Are there particular unique sorts of aspects to that or benefits to that? What are your thoughts there?
Yes, I think that schema therapy deals with long-term problems. And I think the lack of self-compassion or compassion for others is a long-standing problem also.
Hmm.
So this is part of our personality. This is part of our character, how self-compassionate I am to myself, how compassionate I am to others. So they both deal with long-standing problems. On the other hand, I say that, okay, I once trained in, I have been a cognitive behavior therapist for the last 40 years, but nevertheless, I trained in Schema therapy several years ago. I don't think that I have trained in compassion focused therapy. I have attended several workshops. I have attended the introductory 3-day course of the compassionate mind training thing and the advanced skills 3-day training. So, but I don't feel myself I'm a competent compassion focused therapist anyway. So I have been thinking that first I have to say that there are a couple of things I like very much in compassion focused therapy. This is not your fault.
Uh-huh.
I say that to almost every single patient I see. It's not your fault. And they like that. They like that. I actually try to make them think that, okay, it's not my fault. Doesn't mean that I will be someone that does not care for anything. So, but this is not your fault because there is a tricky brain there. But this tricky brain was created through the thousands of ages. This is the way our brain works. So it's not not your fault. So I say them about our tricky brain, and it's not our fault. I also give them a personal example, a personal self-disclosure. I said, listen, I was born when I was born, but what compassion therapy asks me is to imagine how I had been if I was born to the house next to us.
Yes.
And I say, but I would have been if I was born in the house next to us. In the house next to us lived a Jewish family. So if I had been born in the house next to us, I had been Jewish and not Christians. I would have had another father and another mother. And my fate would have been very, very different because the family who was living by us at late 50s, late 50s, actually moved to Tel Aviv. So I would have not been living in Greece. I would have been born in Greece, but I would have been living in Tel Aviv. And I don't know if I would have been a medical doctor in Tel Aviv. Maybe I have been a driver of a fighting airplane or something else. So may I have been killed in one of those bombings there and so on. So I would have been someone completely different. But this would have not been something I had chosen to be. So think of that. Think of that.
Mm.
So they actually understand that there are things that are inevitable. There are things that they have not chosen to be or to become, but they have been there and they become because the situation was that the father was here, the mother was there, the social situation, the economic situation of the family one was born actually was that. So it makes them think that, okay, I'm probably not my fault that I was born in that family, had that father, had that father that was actually addicted to alcohol, or my mother who was depressed, and so on. And that's what I became. But I became because this was my father. This was the father I was given, and this was the mother I was given. But I didn't choose to have this father and this mother anyway. So, and they really understand and enjoy in some way that.
Mm-hmm. Mm.
So those small things would actually I think can be used in any psychotherapy because it gives quite a great relief to the suffering client.
Mm.
It's not my fault.
Yes. And actually, if I think about schema therapy, one of the things that's not our fault is the way that we experience certain emotional wounds, unmet needs, and then we just very naturally come up with a way to make sense of that, which is certain schemas, certain ways of seeing ourselves or others or the world. And then we got to cope with that. So we develop certain coping modes, and none of that's our fault, really. In fact, it's just the way that that young person that we were was able to try to survive in the world that they were confronted with. And so linking the "it's not my fault" to that notion of schemas and developing certain coping modes, seems to be a really nice way in for people to understand themselves, but kind of accept some of those different elements. I guess it's not my fault, but it is my responsibility. So that's the sort of the
Yes,
next bit
yes,
too, I guess,
yes,
is how do
yes,
we
yes.
manage those coping modes? Actually, what are your thoughts about healthy adult mode in schema
Yes.
therapy? I mean, do you see that as sort of the same as the compassion itself? Do you see it as kind of similar, or the compassion is a part of that, or would you see them as quite different aspects of the self?
Yes, Stan, allow me to go a little bit backwards.
Oh, so sure, yes.
I think if we look carefully at schemas, we can see that the most significant, I mean, the most hurting schemas are the ones where compassion was missing, emotional deprivation, mistrust, abuse, abandonment, no compassion, no compassion, no compassion, no compassion. I think they were schemas that were predominated by the lack of compassion, those schemas. So I think compassion, self-compassion, training a compassionate way of thinking and feeling is probably quite good for those schemas. Concerning the healthy adult mode or the compassion itself, I would say that the healthy adult mode is the end point of treatment.
Mm-hmm.
End point of treatment means that, okay, we have dealt with your schemas, with your modes, and you have become a healthy adult. Go away. But I think compassion itself is the means
To get
of
there.
helping someone, It's
Uh-huh.
not the end point product of treatment. It's the
Okay.
means, the compassionate self, I guess. It's the end point, of course, but this is a means that will actually imply changes. I mean, hopeful changes.
Mm.
So I thought that probably there could be, I mean, self-compassion is something we can use everywhere, I said. I can think in any psychotherapy, self-compassion in any treatment. Might it be mental health or physiological problems with, yes. We need compassion in any part of our life, but in any part of medicine, in any part of psychology, in any part of psychotherapy, we need compassion and self-compassion. So I think this is something that can fit everywhere. So, but I think that it will be much more making if we actually introduce self-compassion to schema therapy. I don't know how schema therapists feel about this. Actually, this is nothing. I mean, using a little bit of compassion in schema therapy. Actually, I'm not a schema therapist. I mean, I have trained in schema therapy, but I would say I'm too old for a 3-year treatment, a 3-year treatment, duration treatment. I
Mm-hmm.
mean, I cannot stand long-term treatments now. And schema therapy is a long-term treatment. So I prefer cognitive behavior therapy instead. But I think that we can use compassion in schema therapy.
Mm.
Because I would also say that, I mean, it's very important that the CFT therapist is a compassionate one.
Mm-hmm.
But I think it is something like this when in schema therapy, the therapist actually does uh, limited reparenting,
Yes.
because limited reparenting means that I'm giving my best, the best thing I can give to my client. And I am as much as more compassionate I can feel towards him and toward her. So that's why I think that there are similarities, because the way that actually the schema therapist provides limited reparenting is like what the CFT therapist provides his client. I've never tried that. I mean, in a more scientific, randomized controlled trial way, but I think it helps.
Mm.
It's a little bit unstructured, but I think it helps.
Mm. Yes, I've always appreciated the way that Paul Gilbert coined the term compassion-focused therapy, because it does allow for bringing a compassion focus to all sorts of approaches. We might do compassion-focused CBT, we might do compassion-focused schema therapy, and it really is about taking some of those really powerful bits from CFT and infusing other approaches with warmth and strength and wisdom and compassion. And that can be really helpful. And you mentioned that many of those most difficult schemas, emotional deprivation, abandonment, social isolation, failure, they
Mistrust, abuse.
mistrust, abuse, they really arise out of early experiences where there is a striking absence of compassion, I suppose. And when you raised that point about the limited reparenting, in a sense, that is the therapist with a compassionate motivation and bringing that compassion, that experience of compassion to the client, and offering the very thing that they missed out on, all of those years ago, and giving them an experience of what it is to be cared for, and what it is to be safe and secure, and what it is to have that kind of very genuine, compassionate motivation brought to them. So it does feel like that's kind of really a key and powerful part of how the therapist might approach, well, any therapy, really.
And I think they both use experiential techniques in the same way. I use my healthy adult to help the abandoned child, or I use my compassionate self to actually to guide my non-compassionate other self, and so on.
Yes.
Experiential, I mean, techniques are the same.
Yes, yeah. I did a session recently with someone, and we were using schema therapy, and we were doing chair work in a schema therapy way. And when I invited him to change chairs and to sit in the healthy adult mode, we did a little body-based compassionate practice first to move into that mode. So yeah, I definitely really do love the idea of bringing those two together. Well, um, Gregoris, thank you very much for spending some time with me and speaking with me about all things CFT and depression and the schema therapy stuff. If people are interested in your work, or would like to be in touch, how can people be in touch with you?
Actually, I'm in the phase of I go to my private practice only once a week.
Okay.
I'm retiring. I mean, I have retired from my university 3.5 years ago. So I'm trying to retire from my private practice also. But if someone wants to find me, yes, he or she will find my email address. That
Yes.
is gsimos dot etc. Yes, yes,
Yeah,
yes.
no, that's
I would say that I am, excuse me, I'm 100% active, um, although I'm retired. I mean, yes, yes,
right. Okay, that's a good way
yes,
to
yes,
good
yes.
way to say it. And of course, people can definitely sort of have a look at compassion-focused therapy, clinical practice, and applications that will give them a good sense of where you're coming from as well. So anyway, well, thank you very much for.
Let me remind you that compassion focused therapy, our book has been translated into Italian, Portuguese, Turkish, and Korean. And my publisher has already agreed that we are going to translate our book into Greek too. I mean, yes,
Aha.
yes. So
Wow.
I think it's a great success because if we talk about Portuguese, then it means that half the North America speaks Portuguese, I guess. So
Hmm.
this will be a book that can be read by South American colleagues
Yes. No,
also. Yes.
that makes it sort of very, very accessible, really, which is the key,
Ye-
is the
Yes.
dissemination
Yes.
of
Yes.
CFT. Yes.
Stan, thank you very much for inviting me. I have been very, very anxious how I can go on with that. Um,
I I thought you
those,
did very well.
those, those are my notes.
Okay, right. No,
As,
no.
as almost as if I'm giving exams, but anyway, this is me. I mean,
Well, you passed with flying colors,
thank you,
and
thank you,
Gregoris Simos, I really appreciate it, and thank you for being on Compassion in a T-shirt.
thank you very much.